Brad Williams, Frugal Finance, an overview of Medicare. Medicare is a health insurance program funded by the U.S. government designed to assist older adults and some individuals with specific medical conditions. Its primary purpose is to cover healthcare costs for people aged 65 and older, though it also extends to younger individuals with qualifying disabilities as well as those with certain serious health conditions. While Medicare provides extensive coverage, beneficiaries may still have to pay for some medical services, which introduce both flexibility and complexity in managing their health care needs. Key points about Medicare. Medicare serves people age 65 or older, certain younger individuals with disabilities, and those with end-stage renal disease or amyotrophic lateral sclerosis, ALS. The program consists of 4 parts: Part A, Part B, Part C, that would be Medicare Advantage, and Part D, prescription drug coverage. Individuals who qualify for Medicare Part A, based on prior contributions, typically do not pay premiums for this coverage. Other parts of Medicare, such as Part B, may require monthly premiums. How Medicare functions. Medicare is managed by the Center for Medicare and Medicaid Services and is funded through payroll taxes under the Federal Insurance Contribution Act. Medicare typically covers people when they reach age 65 or those who are younger but have qualifying disabilities or severe health conditions like ESRD or ALS. If you qualify for Social Security benefits at 65, enrollment in Medicare Part A and Part B is automatic, which covers hospital and doctor office visits. However, for other parts, like Part D for prescription drugs or Medigap, supplement insurance, individuals must sign up separately. There are specific periods during the year when individuals can enroll in or make changes to their Medicare coverage. Who can qualify for Medicare? The eligibility requirements for Medicare generally apply to U.S. citizens or legal residents age 65 or older. You may qualify for Medicare Part A at no cost if you or your spouse have worked and paid Medicare taxes for at least 10 years, you meet certain criteria for railroad, retirement, or Social Security benefits, you have specific conditions such as ALS or permanent kidney failure. You may also qualify for Medicare before 65, been receiving Social Security disability insurance for 24 months, or if you're diagnosed with ALS or need kidney dialysis or a transplant. Medicare coverage types. Medicare is divided into several parts to cover different healthcare services. Part A, hospital insurance, covers inpatient hospital stays, skilled nursing facilities, hospice care, and some home healthcare services. Part B helps cover outpatient care, doctor visits, preventative services, ambulance services, and durable medical equipment. Part C, Medicare Advantage. This plan is an alternative to original Medicare and is provided by private insurers. These plans may offer additional benefits like dental and vision care, but they might have more restrictions regarding healthcare providers. Part D, prescription drug coverage, covers prescription medication costs with premium payments that vary. Understanding cost under Medicare. Medicare Part A is typically free for those who have paid Medicare taxes through their employment or for spouses who have done so. However, Part B, which covers doctor visits, has a standard premium with higher premiums for individuals with higher income. Part D covers prescription drugs, and its cost depends on the plan you choose. What does Medicare not cover? While Medicare offers extensive coverage, there are still gaps in benefits. For example, it does not cover long-term care or custodial care, and it does not pay for services like dental care, eye exams, or cosmetic surgeries. For these services, individuals may turn to other insurance programs or pay out of pocket. Comparison of Medicare and Medicaid. Medicare and Medicaid are both government programs but serve different populations. Medicare is primarily for people 65 and older, or those with specific disabilities. Medicaid, however, is designed to help low-income individuals, covering a range of medical services with eligibility based on income and other factors. Some individuals qualify for both Medicare and Medicaid, and these people are referred to as dual eligibles. The evolution of Medicare. Medicare was established in 1965 under President Lyndon B. Johnson. Initially, the program only covered hospital and medical insurance through Parts A and Part B. Over the years, Congress expanded the program, adding coverage for prescription drugs, Part D, and allowing private insurance companies to offer Medicare Advantage plans, Part C. Medicare has continually evolved with notable changes in 2003, 2020, and 2022 that introduced new benefits and financial safeguards, including changes in prescription drug coverage and caps on out-of-pocket costs. Medicare is a vital health insurance program for millions of Americans, offering coverage to those 65 and older, as well as certain younger individuals with disabilities or severe medical conditions. While the program provides extensive healthcare support, understanding the details of each part and the associated costs can be complex. Whether you're new to Medicare or need to make changes to your coverage, it's important to stay informed about the various plans and options available. Comment. If you have any questions related to Medicare, I have an extensive list of Medicare-related videos. Check it out on my YouTube playlist, Medicare. Brad Williams, Frugal Finance. Thanks for watching. Hope that helped. See you soon.